Okay, colonoscopy screening. How come I get the fun ones? All right. So the question is, doctor sees the patient in the office for screening colonoscopy. So they're like, is it V76.51 or V76.59? The doctor spends about 15 minutes with the patient, and then we go in and spend another 10 minutes explaining prep to them and signing consent. So they're upset. Now Medicare wants you not to be paid for that office visit. Is there a special code to use? Give me the secret. How do I get that office visit paid? So you might not like my answer, but this is what our research showed. And basically we do these answer sheets. They're like a scratch pad. It's just what we encourage you to do to be your own researcher. And I used to do a session on that at local AAPC chapters on how to be your own consultant. Maybe I should bring that back and show people how to look up things like this. So at any rate, colonoscopy screening. We need to look up these two codes that she referenced. V76.51 says screening for malignant neoplasm of the colon, or it could be screening colonoscopy not otherwise specified. V76.59 is screening for malignant neoplasms other sites. So the answer, because she said it was a colonoscopy, is going to be V76.51. And if it's high risk, then it's going to be V16.0. And that needs to be your lead code because that tells Medicare right off the bat that it's a screening. And I know some of you are probably saying, well, doesn't the procedure tell them that it's a screening? Yes, but they use different fields to do particular edits. So in this case, they're using the diagnostic field to do that. So when you do these screening colonoscopies, always lead with the V code. Now, I found some resources for you. MLN, Medicare Learning Network, has great articles on things like this when you get stuck. So I recommend you go check this out. I can show you real quick. It looks like this. And it's a little more casual compared to some of their other types of documents, but colorectal cancer, preventable, treatable, and beatable, Medicare coverage and billing for colorectal cancer screening. So if you are getting denied for something that you feel you should get paid for, these are great to reference in an appeal letter. So, just kind of read through this. And I did grab a piece of this. Where is it? Down here, this chart here, how to bill Medicare. And these are the codes that they want us to use when you're billing Medicare for cancer screening. So G0104 is for when you do a flex sig to check that. 105, colonoscopy on an individual at high risk. So that should match up with that high risk V code. 106 is colon cancer screening when they use barium enema as an alternative to doing the flex sig. 107 is FOBT, 1 to 3 simultaneous determinations. That's fecal occult blood test. And the 1 to 3 simultaneous determinations are the little cards where they do the smear. So they do that 3 times. 120, barium enema as an alternative to 105. So instead of the high risk one, they're doing the barium enema one. 121, colonoscopy for individuals not meeting criteria for high risk. 122, colon cancer screening, barium enema non-covered. So this is where you're doing the colonoscopy, the patient doesn't have any diagnoses, or maybe it's too frequent since the last time they had one. It's not going to be covered. You have the patient sign the waiver, but you still need to report to Medicare that it was done. The G0328, this is as an alternative to 107 using the fecal occult blood test. So though a lot of choices for this particular procedure. So keep that in mind. Those are all the different G codes for Medicare. And I have this in the handouts. Then there's this other chart, which is really excellent. I remember this when I was very first learning coding and billing. This is your preventative services chart. And it's if you just go to cms.gov and you type in preventative services, you'll probably come across this PDF link. But notice on the left, it's talking about the preventative services. We've got your initial preventative physical exam. We've got the annual wellness, the ultrasound screening for the AAA, the abdominal aortic aneurysm, cardiovascular screening, diabetes, medical nutrition, screening of PAP, pelvic exams, screening mammos, bone mass. There's the colon. Okay, so colorectal cancer screening. Here's all the G codes we just reviewed. Okay, and then they also have this lab code 82270 for the FOBT. They're not specifying that you have to use particular diagnoses codes, but we do know you need to lead with the V code. Who's covered? And this is what becomes important with preventative medicine. They will pay for some preventative things, but only so often and under certain criteria like patient age and things like that. So Medicare beneficiary has to be 50 or older, at normal risk of developing colorectal cancer or at high risk of developing colorectal cancer. And then high risk is defined in this particular CMS manual. And they actually give you a nice little hyperlink if you want to go check that out. The frequency. So we have age. Now we're going to talk about frequency. You can do the FOBT every year because that's a fairly cheap, inexpensive test. The Flex Sig is once every 4 years. Then a screening colonoscopy every 10 years or every 20 months if you're at high risk. So the colonoscopy, by the way, is the one that's all the way up, over, and down. So it's the whole upside down U of the colon, whereas the Flex Sig is just going to a portion of the descending colon. So if you had to divide it, it's about a third of the way, if you will. And then barium enema is covered as an alternative every 2 years. Okay, so that gives you an idea of the frequency and other issues surrounding this. I found this in my research on the AAPC discussion forum, and I thought the person's answer, I couldn't do it better, so I just copied it. So the questioner was saying if a patient comes in for screening only, V76.51, and also has a history of polyps, V12.72, or V16.0 if it was high risk, but the doctor finds polyps in the rectum and removes them by snare, and a polyp in the cecum and removes by cold forceps, what is the correct billing? So she gives the 2 CPT codes, okay? She gives the diagnosis, and notice how leading with that V code. And then she says, make sure when you actually bill a claim that you do not designate a diagnosis pointer, meaning a non-V code, with your screening diagnosis code. Okay, so in her example here, 45385, the pointer is going to be 569.0 only. And then for the V5380.59, it's going to be 211.3. In other words, you do not see the V codes listed on the claim form, but it's not linked to any of the procedures. Okay, the V code is to let Medicare know that the intent of the procedure was for a screening. So they went in for a screening, they found a polyp, they took care of the polyp. So it turned into a treatment, but that wasn't the intent. Okay, so now if nothing's found, like there was no polyps, then it would have been the G0105 or the 121, depending on whether they're regular risk or high risk. And then the diagnosis would be the V76.51 to go with the G0121, or the V16 high risk one to go with the G0105 high risk screening. Okay? Now, going to the question about that E&M visit, where they're kind of prepping the patient for all this and feeling like, gee, that's a lot of work, we should get paid for it. Here's an article that I found in Find a Code, which I use all the time to look up my codes online. And it says, while separate payment is not currently made for these visits, fee schedule payment amounts for all procedures, including colonoscopy, contain payment for the usual pre-procedure work associated with the procedure. So I'll just show you what that looks like. So if you are a member of Find a Code, I have to sign in here. You can find articles like this and then, go ahead and, read it. And that's where I found that information. So I'm definitely going to do that, I think. A session on how to be your own researcher, your own consultant. There you go. So the bottom line, haha, no pun intended, is that there is no office visit code to be billed, just the colonoscopy. The discussion and prep is bundled into the procedure. So a long way to get you to know. Sorry, there was no magic pill for that one.
Get more CPC exam tips, coding certification training, and CEU credits. Go to www.codingcertification.org.